Welcome back, guys, to another massage video. Today we have a back massage where my client complained of low back pain and tension, and so that's what we're going to be focusing on in today's session, working the lower back muscles, and I do work into her hips, but that's not in this video.
Because you're driving more than
I
used
don't know,
to.
my back just hurts. This week it's really been bothering me.
Okay.
Does it feel tight?
It does feel tight. Just the initial compressions feel tight.
I made sure during this massage to really focus on the warm-up and introducing myself to their body. So I'm just taking my hands and I'm walking down their back, avoiding the spine, feeling what their back feels like. Is it pushing back on me? Finding areas where the tissues feel stuck, paying attention to the curve of their thoracic spine and their lumbar spine, taking my fingers and feeling the sacrum and the iliac crest and the SI joint. How does it move? Is it stuck on one side more than the other? All of that can be assessed within the first minute of just doing over-the-sheet compression. And then we finally undrape, and we have access to the back. Lifting the client up, love my mechanical table, and then warm up the lotion. Now, as I said, I'm really focused on warming up very well during this massage. So I'm doing these long flowing effleurage strokes, using my whole palms, covering as much surface area as I can, and then very slowly gliding all the way down the back, where I will then hold at the sacrum, spacing apart the hips, pushing open those hips, and then I do a wave on the way back up, bringing those sides in to meet the middle of the back, allowing the whole back and the sides to feel connected as one. Yes, there's different muscles, but they're all pulling in a game of tug of war. And then we're going back to the sacrum, once again, pushing it down, opening up that space. A little bit of alternate patterns here. All of this with the mindset to really introduce ourselves to the client's back, to their skin. Even people who get massaged regularly, touch is still such a powerful feeling. So we really want to make sure that they understand we're here to help them. We have intent. And we do that by giving a light but firm pressure. I'm working up into the neck, pulling that suboccipital and back of their neck region up into the scalp. Work a bit into the hair if the person's okay with it. And I'm moving my body along with the rhythm that we're finding in the massage. Bit of petrissage there, and I'm doing some knuckle holds. I absolutely love this technique, and just because I've switched to my knuckles, this is still a warm-up technique. We're compressing the top traps, the shoulders, pushing them down, keeping those ears and those shoulders away from one another. Those two are star-crossed lovers. The shoulders and ears love to meet. And even though, as I mentioned, it's my knuckles, I'm keeping that hand very soft. There's not a lot of sharp points that are happening. I'm just taking my time to really dig in to that thick belly of the trapezius, the levator scapula, and now we've transitioned that into the rhomboids, where I'm just gonna iron them out. We're about 5 minutes into the session, and so I feel that it was an appropriate time to jump into some of that deeper tissue. And look at that speed. I am going slow. A little bit of a vibration, rocking. And just iron out either side of their spine all the way down to that low back. Wipe it away, working from the center outward, following those natural lines of tension that we find in the skin. And if you look closely, you can even see a little bit of redness in that low back there. I do switch up the angle later to give a better view of the low back. But now we've transitioned into my forearms. This is certainly deeper than the palms will be, but we're not sharp points yet. I love this hold into people's low back. You take the ulna side of your forearm and you start from the center and just pull down through all of those dense, tight areas in that low back. And really what you're working are the erector spinaeus, a little bit of the lats at the thoracolumbar fascia, and then the QL and the obliques. Pull that forearm through and then follow it up with the side, working the lats, much more of the latissimus, the teres major and minor, and your fingers are also cupping over the rotator cuffs. And a lot of times I will drape my client's arm on the side of the table, and this is a fabulous technique to really open up the shoulder and create space within that joint, within the capsule. And still pay attention to just how slow we're going throughout the whole massage. Down into the tricep, constantly keeping a lovely flow. And then this is one of the few areas I like to work back towards the body, is the rear delt and rotator cuffs, where I am taking my flat knuckles, a nice iron, and I'm pushing those muscles back towards the spine, because those muscles tend to get overstretched and they're pulled away from the midline. So I'm going to take those tissues and I'm going to push them back towards the midline, trying to reinstate balance. And this is multiple minutes on just the side of her back and body, right? Bringing in sides of the body, the sides of the back, and linking them with the middle of the back where everybody feels those deep, tight muscle knots. And following the knuckle, that's tailed behind the flat palm. It's like a beautiful therapeutic train. Choo-choo. All the way down to the sacrum. And when you get onto that iliac crest and the upper hip glute muscles, sink into those and then wipe them away to the outside, moving laterally. And the sacrum is a great midpoint there to do some nice fingertip pressure, a bit more specific, as we transition to the other side. And here we're just going to follow the same routine that we did on her left side, but now it will be done on the right. This gives us a better view of what I was doing with the forearm earlier. So it looks like I'm using a lot of my elbow. Oh, that was an interesting muscle twitch. However, the elbow's not very sharp and I'm not pressing that hard. Now, here we go. I can sink my forearm into that belly. I'm keeping my wrists relaxed and supporting them. And then we're just slowly gliding down, pulling out. I'm sinking that bone, the ulna bone, into her low back. And maybe the obliques are tight. Maybe one part of their body isn't giving as much as we want it to. We come in with broader and lighter pressure if that's the case. Here I'm following, looking like a rhomboid pull with the knuckles. And then that's where we transition into our rotator cuff push. Once again, pushing those muscles back towards the center. This client has good skin, but you can see a little bit of that hyperemia, that blood flow coming from the work we're doing. Really deep knuckles here. Looks like I'm applying some good pressure now. All the way down into that low back, and I will sit there and hold with the knuckle. Same thing with the forearm, but the knuckle is giving deeper pressure because it's more specific and a bit more sharp. Follow that line once again. Oftentimes in massage, we usually follow the rules of 3. Doing something 3 times feels very natural, very comforting, and very even, very balanced. In this video, it seems like I wasn't perfectly symmetrical with my routine, and that's okay. However, watching it back, I notice I didn't work her lat going up to the shoulder, and I should have. So it's always cool to watch things back and be like, okay, well, I should have done this different, and I clearly just missed that technique. And I've moved up to trap squeezes. Most of the work is being done by my fingers here. The thumbs are just there as supporting. I'm not actually using them that much. We did some nice trap, circular friction up into that suboccipital spot. I just love working this spot. Oh, the base of the neck is tight. Tight on, everyone. And so, as I was saying, it's not always terrible to not do the same exact routine, and you're really not going to with each new client. However, in this case, I missed the lat pull on that right side, and I really should have done that. Maybe I do it deeper into the massage, we shall see. But once again, there are times where I'm pressing in, especially into those thick, strong muscles, the rhomboids, the traps. If you work too quick, those muscles are so strong that they will just kick you out, and they will win. You will not win that fight. And so you can see it looks like I'm not even moving. I am just holding and allowing those muscle fibers to melt away, letting me through. I am giving them all of the power. I'm just holding, and over time they will let me through. And as a result, I was able to follow through there, and what I'm noticing is no inflammation, which is good. I have seen plenty of videos where the people attack the traps, and the traps get inflamed and they fight back, and the therapist will say, oh, look at all the tension that's been released, when in reality it's just a ton of puffiness because the body has sent a bunch of blood to the area and their traps are all angry at you. So yeah, it doesn't look tight anymore, but that's because it's all just puffy. Back into the forearm drag. Okay, and I kind of am working those obliques up into the costals, that's the rib heads. And this 15 minutes in is the first very deep low back move I'm doing. And I love this one. an elbow to the quadratus lumborum. I pulled away, and then the important part of this technique is that I am then pushing back towards the center with a sharp elbow, and I'm coming from underneath. So I'm pushing my elbow in through the oblique, angling it upward, really attempting to get underneath, almost underneath the spine. Now, obviously, you're not going under the spine, but that's the direction. You're angling it upward and inward. And that is going to access the QL, and people are going to feel this. The amount of clients that, after this technique or when it's being done, are just amazed. They're like, that's the spot. And this will really set you apart from other therapists to get into a quadratus lumborum muscle adhesion, especially because the QL attaches on the lowest ribs on the intercostal side, and then it comes down and attaches to the inside of the iliac crest. So if you find the tension on either of those attachment points along with the center belly, you are going to give them so much freedom, so much movement in their trunk. They're going to be able to spin around, rotate, bend easier, and they will notice. And then here I'm bringing in the other side. I know it's blocked, but sharp elbow once again. With my left arm, I like to work the center and the iliac crest, the hip attachment. And then I'll bring in my right arm and work the center and the rib attachment. So using different tools for different jobs. And once again, I'm keeping my wrist completely relaxed. Look at it flop. It's floppy. A little trick if your client's ever tight or tensing up is you can breathe out very loudly, and that will often get your client to relax.
Good. Sometimes we've got to give it the people's elbow.
And then after any deep tissue work, we're always going to make nice with the area with a softer, broader pressure, in this case my knuckles, and then following it with stacked hands and palms. And you can see a little bit of redness there in the low back. That's nice localized blood flow. Alright, I decided that it was not released enough, so we're going back in. Even though this shot is mostly my back. But we'll be switching the camera angles in about 40 seconds. And from here I followed up the spine, so I took it to the low back, all the way up into the rhomboids, following that through the top of the shoulders, where the shoulders meet the neck, back to those star-crossed levers. And really making nice with the palms after that. Changed angles to another nice angle that shows the low back a lot better. And this is not exactly what I was doing earlier, but you can see using the elbow and the forearm into the rib muscles and vibrating back and forth in between each rib. I'm really working the space in those intercostals and then gliding my way back up. This is going to create space. Those rib cages get compressed down, their spine gets compressed down, and all of that little shaking I'm doing, along with the deep holds, that is going to create space. And if an area is a little tight, it's not letting me in, I can kind of jostle my way in there. Real sneaky-like. Follow it down all the way through the upper trap. making sure to almost follow into the front. And then this needs no introduction, my bread and butter move. I do this every session on everyone. My bread and butter move, I love it. Using the same forearm, you're pinning their head. Using your hand, you can hold their head, you can work their hair, and then take that elbow and run it through the front of the scalenes, through the traps, into the levator, twist around, and follow that same deep line. Work all the tension in the upper back that people hold in those rhomboids. And make sure not to pop off of the traps. I see a lot of videos, people popping off of the traps when you don't have to. You can either come off gently like that, or you can also work all the way down and follow the ESGs to the sacrum. And then this is a new addition that I've been adding over the last year or so, where I will follow that with a double stacked finger pull. And this is really targeting the scalenes in the front of the neck. But it's really opening up the front of the neck, which is very good, very helpful for anyone with numb hands, cold hands, poor circulation, or shoulder pain as well. And it creates a good opportunity to transition to the other side of the body, since you bring your body over there in the first place. Here's a great angle of what we've been doing with the forearm and the elbow into the low back. Finding where we want to apply that strong, specific pressure, keeping my wrist relaxed, and with my right side here, I like to target the hip crest and that lower back attachment of the QL, going as far as to getting into the SI joint itself. And vibration. There, while I'm holding the low back, I kind of use my other hand to sweep. And if you notice, even when I'm using my right hand to massage, my left hand is constantly reassuring the client. It's firm, it might do an occasional stroke, and it's very important that you always keep both hands as much as possible on your client, because people like predictability and they like to know where our hands are at. So if you have one hand that's missing, it not only feels weird, but people will kind of be like, what are they doing? And I'm taking my left elbow and getting nice deep pressure into that low back. Making sure to avoid pressing too deep into the ribs or the hip bone. Never feels good to press into bone. Following it all the way up to the spine, stopping just before we actually press into the spine. Drag it back out. Following with the broad knuckle. And by turning my knuckle to the side like that, it got a very sharp line of knuckles, so I know that that's going to be a lot more specific, targeting the tension that we feel. Break it all up and make nice with the smooth circular effleurage, glide all the way up. A more broad elbow as we work that up the rib cage into the upper back muscles. Making sure right here we're not going to pop onto the traps, we're going to slowly glide onto them. Kind of blocking it, but I lifted my elbow and then set it back down once we got to the traps. And we get to see my big old head, but I'm just doing the bread and butter move on this side. Supporting their neck, putting the elbow in the traps. The camera did a good job at focusing on her still and not me. Alright, Spencer, move your head out of the way. And back. Finish up our bread and butter move. And then, as I said, I've been doing this lately, the pull, where we grip forward and use the fingertips to really pull the anterior neck that always gets so rounded and so stuck together. And then stack your fingers and really pull apart their trap and scalenes and levator muscles. That really does provide such a big relief for your clients. And I'm using the knuckles turned outward to once again create that sharp line of knuckles that almost creates like a razor where you can go in and just cut apart some of these tight knots and tight fascia, even areas of tight skin. And anytime we do something deep, we follow it by making nice with long flowing strokes back to our effleurage, kind of petrissage. And I always like to come back and work into that suboccipital region, right under the skull, and really give that a good stretch and pull. Shaking while doing it. And because I don't have my knuckles turned out so much, this is more of a broad ironing out. You can actually see the lines that we made there, so you can see what direction we kind of went down. And a sacrum shake, just rocking the sacrum and low back and forth. Supporting the shoulder here as I lift up the scapula slightly and then use my forearm to glide all the way through it. Now, noticing I do have my left arm internally rotated a lot, and that's something that I generally advise us as therapists to avoid is rotating our shoulders in too much. I'm doing it here. I still wouldn't recommend doing it a ton. Just really using... Camera's freaking out there a little bit. It doesn't know what to focus on. Using my hand to really support my forearm. Back and shoulder as well. Push down those shoulders, and we're going to go into our cool down, where we just do some light petrissage and squeezing. A final palpation to feel how everything is feeling. Feel if it's loosened up enough and that I'm happy to move on. And I will ask the client as well, once I wrap them all up, and say, did this get enough work? Then we can cover them up and move on with the rest of the massage. Thank you so much for watching, guys.
Alright. How's the backside feeling there?
Pretty good.
Did it need more work?
I think it was
Feel like it's got enough?